Hi, my great people. Welcome again to this channel of Elizabeth Washera K. The one I talked about last week that I'm going to bring you lessons about diabetes. And before then, it's good to know who is this Elizabeth. Elizabeth is a registered nurse who is experienced in diabetes for quite some time. I started my journey of diabetes education at Kikuyu Hospital, where I was employed immediately after my college, that is 1992. And I attended a course on diabetes, which was being offered by the president of diabetes education by then. Her name was Jane Sulen, may God rest her soul in peace. Then I joined Kikuyu Hospital. I joined Kenyatta Hospital the year 2000, where I expanded my knowledge and my experience about diabetes, where I attended several seminars on diabetes education, on diabetes complications, on diabetes nutrition, and it was within Kenya and outside Kenya. That is, I attended one seminar in Ethiopia. I was among the first people who presented in the first East African Diabetes Summit. I presented a paper on experience on diabetes education with one of the items we were using to help people understand their diabetes more by visualizing. We used to use something we call conversation map, which we used to put on a table. It is drawn pictures that they can relate with day-to-day life, and they are able to understand more. As we say, when you see, you remember. I think that is the theme they used by then. And it was quite interesting because we could get people interacting, and we are able to know who know what, and we are able to help them further. And I've been to South Africa 3 times. The first time was there when they were launching insulin by name Lantus, which is commonly used in Kenya and also outside Kenya. Since now I'm currently in the USA, I've been there again to attend a course in Johannesburg University on diabetic food, where we were being taught on how to examine clients' feet and able to help them. Because of neuropathy, they get things and problems without their knowledge. And by examining them, we were able to detect and help them earlier. The last time I was there as one of the educators to be able to get more knowledge on how to help other educators, so that we can be able to help people in education to create awareness to prevent this diabetes, because diabetes has really expanded and it has become a burden to individuals, to the families, and also to the nation and to the world as a whole. And that's why I've chose to come and talk about diabetes, because I have a good experience. 17 years working in the diabetes clinic in Kenyatta National Hospital, which is the biggest referral and teaching hospital, East and Central Africa. And I would like to thank my colleague back home, those we used to work with. We worked so tirelessly. Our doctors, our consultants, they used to come, join hands, discuss, and we are able to help our clients and our patients. So I used to do a lot of education. We used to do education every Wednesday. And by so doing, I feel I still have to give out what I've been doing, or what I'm feeling. I have that push of continuing with this education, because there are many people who are suffering out there without their knowledge. They don't know what to do. Their relatives don't know. Their friends don't know. And so they are dying quietly. And others, they think that they have acquired something that is an I don't know, a curse. So you find somebody hiding that they are suffering from diabetes. But please, speak it out so that you can be helped. Diabetes is a condition that you can live with it and live a healthier, longer life. So please, come out, ask questions if you have any, go to any hospital, go to Kenyatta Diabetes Center, and I'm sure they will not send you back. Because I've been working there, I know the experience there. We used to get people, we know Kenyatta is a referral hospital. But I think when I left there, they had opened an outpatient where you can go and you're able to be registered into the clinic. Not like before that you had to have a referral letter. And I still remember even then, I remember one of the guy who came and said, I am here, you sent me away. He met me, but I didn't do that. I was able to help him because wherever he was going, he was not able to be helped and he was very wasted. So please, when you ask, you'll be helped. But if you don't ask, nobody will know whether you are suffering. And it is said, my people will perish because of lack of knowledge. So let us use this knowledge and let us help other people as we help ourselves. According to the research done last year, 2020, yes, the world as a whole is suffering because we have around 460 million people with diabetes. Africa, we have around 19 million people with diabetes. Kenya, we have over 500,000. And it is predicted by the year 2045, people will be having diabetes in Africa will be over 46 million. And diabetes, well controlled, it has no problem. But wait until you get those complications. And that's why I am here to help somebody. I may not be able to help so many people, but there is this one person who will listen to me and get to follow instructions, control their sugars, prevent their complications, and live a healthier life. And they will remember me. So, that is why I have decided to come to help you, because complications are tough and they can drain you mentally, physically, and financially. And when they drain you as a person, it starts draining other people. So, please, people may ask, what is this diabetes? There are people who have never heard about, or they just know the name. What is it? Diabetes, it's a condition that one gets when the sugars goes very high. And why do the sugars go very high? Above the normal ranges. The sugars goes very high because your body is not able to make use of the food that you are eating. We call it a metabolic problem. So, why is it not able to make use of that food? Because there is something lacking in your body or not working. There is an organ in our body we call pancreas, which is the factory of a hormone which is very important in our body. We call it insulin. Insulin acts as a key. You cannot enter a house or a room without opening. So you have to use a key to open. So here, the insulin you have in our body is the key to open the doors for the glucose that you have, the food you have eaten, it to penetrate, to enter into our body muscle cells. These muscles are made of cells, so many cells. Our bodies are made of, think of trillions and trillions of cells. And these cells need sugar, they need energy to act or to work. They cannot do that without insulin. So, when you lack insulin, your sugar accumulates in your bloodstream. When your blood sugars are tested or glucose is tested, they are found to be very high. Ideally, your sugar should not go beyond 6 or 7 millimoles when you are tested in the morning before 9 a.m., when the body has not started reacting. Then, if you have eaten after 2 hours, when we say it is the body has stopped metabolism or digestion has stopped, the sugars, it's at their maximum in the body, should not go beyond 10 or 11 millimoles. So, when you find yourself, your sugars going higher than those ranges, you need further investigations, because that is one sign that your body, that your glucose or your blood sugar is going high. So my dear friends, this is the first step of this journey of diabetes education. I am here to tell you, we are going to move or to walk this journey together. I have started just to mention what is diabetes. I'll be coming with more and more. We will get to know into further details how diabetes comes about. What are the predisposing factors or the risk factors? And then from there, we'll go to signs and symptoms. From there, we'll go to the management. How can I manage this diabetes? There are different ways of managing or controlling your sugars. From there, we'll go on to know about the treatment. I may not be able to treat you, but I'll be able to advise you according to the medication you are using. The ones that you swallow or the ones that you inject. I can give advice, as we used to say, to advise people, and it might help you. Because you may swallow your tablets wrongly. It is the right one, a good one, but you are taking it wrong time. You don't have specific time, so it might not help you. So I'll come to talk about that until we reach to the complications. And in case of any questions, you can go to my Facebook page, and sometimes I'll be coming live. And in case of any questions that I may not be able to answer, I'll be bringing aboard a specialist to be able to help you with your problem. So I'm very grateful today to start this journey and to start with you. Thank you very much, and let us move together, and let us go there and subscribe and share with people. You might help somebody without your knowledge. Thank you. See you next time.